Welcome to On the Clock.
I'm True.
I'm Jessica. We'll be on the clock answering your questions about sex. But first, let's be transparent. This video uses info from .gov and .edu websites, except when otherwise mentioned. For now, cases from my clinical experience are excluded from the information presented to you.
If the first subject is too sensitive, don't listen to the rest of it. Just shut it off.
Jess, is that your real computer?
Jess, focus. We're on the clock in 3, 2, 1.
Commonly abbreviated as UTIs, urinary tract infections occur when bacteria creep into the urinary system, causing inflammation and pain and/or burning, particularly during urination.
Other signs and symptoms include cloudy and/or foul-smelling urine, maybe with a little bit of blood in there, and frequent urination with little volume. You might also feel tired, weak, or shaky.
Your risk of acquiring a UTI increases if you have diabetes, if you're sexually active, especially if you use a condom with spermicide or a diaphragm, or if you're pregnant or going through menopause. To prevent UTIs, urinate every 3 to 4 hours and before and after sex. Remember to wipe front to back just like your mama taught you. Make sure to stay hydrated, and if you start experiencing these symptoms, just pound down some water and call your healthcare provider.
Okay, wait. Why do my female friends get more UTIs than guys?
Simple. Females are 30 times more likely to contract UTIs than men because a woman's urethra is closer to the anus than the man's.
Well, doesn't cranberry juice treat UTIs?
Based on my literature review, no, but cranberry products pose little harm, so it's worth a shot.
All right, we're moving on to that disease with the name that you love.
Which one?
BV, or bacterial vaginosis. Come on, it isn't that bad.
BV is an imbalance of good and harmful bacteria in the vagina affecting nearly 30% of women in the United States. Though some women experience no symptoms at all, others may have a fishy odor down there accompanied by thin, white, or gray discharge.
It's common to experience pain, itching, or burning near the vagina. Zesty!
That's not zesty at all. That's horrible, Jess. How do I avoid this?
This? Oh, you mean bacterial vaginosis? It's easy.
Wear cotton underwear and clean the vagina using warm water. Avoid douching and using soap because even mild soap can irritate the vagina. Also, limit the amount of time wearing wet clothes, such as a bathing suit, and don't have a lot of sexual partners. BV can clear up on its own. If it doesn't or gets uncomfortable, call your provider.
Speaking of uncomfortable, can we talk about when women can get pregnant now?
Women are most fertile 8 to 19 days after the first day they start bleeding on their period, if their cycle is regular.
Okay, so since you can get pregnant when the egg binds with the sperm, shouldn't we address how long the sperm can last in the body?
Right.
Sperm can live in the vagina for 3 to 5 days, but many sperm die within the first day.
Can you tell if you're ovulating without going to a doctor or a home test?
There aren't 100% accurate, but there are indicators you can see at home, such as an increase in morning body temperature 12 hours after you ovulate, and an increased vaginal discharge.
The discharge is clear and stretchy.
Great. Now I hate eggs. Let's get on to my favorite part, the Q&A portion.